Welcome, everyone. Thank you for joining us for today's discussion on dental health in pregnancy and young children. My name is Kezia Fosuata. I serve as the policy manager at Groundwork, Ohio, and I work in the maternal and young child health field. Before we begin, I would like to state that today's webinar is being recorded and closed captioning is available. Additionally, all participants are advised to stay muted. We encourage you to forward your questions to the Q&A box. We have a full agenda today, so if we can't get to your question during the event, we'll follow up after the event if you provide your email address with a question. Lastly, all participants will be forwarded a recording of the event and its materials after the conclusion of the event. Also, please remember to follow Groundwork Ohio on all social media platforms and our panelists on LinkedIn as well. I'll begin the panel by introducing our speakers, but before I do so, I'd like to go over Groundwork Ohio's mission and work. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization formed in 2004 that champions high-quality early learning and healthy development strategies from the prenatal period to age 5 that lay strong foundation for Ohio's kids, families, and communities. We advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. Today, we have two amazing panelists joining us for this conversation. First, we have here Dr. Amini. Dr. Amini is a professor of pediatric dentistry, clinical at the Ohio State University College of Dentistry, and an attendant dentist at Nationwide Children's Hospital. She received her dental degree and a master's degree in public health from the Ohio State University and a Master of Science and certificate in pediatric dentistry from the University of Illinois at Chicago. She's a board-certified pediatric dentist and a fellow of the American Academy of Pediatric Dentistry. Her research interests include health disparities, health literacy, and child advocacy. We're also privileged to have Susan Lawson join us as a panelist today. Susan comes with an in-depth experience in dental policy and initiatives across the state and the country, as she serves as the Director of Oral Services at the Ohio State Association of Community Health Centers. Susan joined OACHC in 2009 after her time at Nationwide Children's Hospital as a research studies coordinator for Dr. Paul Casamassimo. She currently leads an array of oral health projects and is looked both internally and externally as an oral health subject matter expert. She was instrumental in the Early Childhood Oral Health grant, the National Oral Health Innovation and Integration Network grant, and the HRSA Midwest Ohio of Oral Health Integration Grant. She also co-authored the ECOH Implementation Guide, a fluoride varnish initiative during well-child checkups. A graduate of the Ohio State University and Keller Graduate School, she holds a degree in education and has a Master of Human Resource and has a master's degree in human resource management. She enjoys reading and being a nana to 9 grandchildren. Welcome, Dr. Amini and Susan. Thank you for joining us today. I'll now give way for each panelist to give their 15 to 30-minute remark on dental health in pregnancy and young children. Dr. Amini, if you could please go first, and then Susan may follow. Also, to the audience, please know that you can forward your questions to the Q&A chat box. We've set aside 10 minutes to answer your questions after their remarks. Dr. Amini, you can take it away now. Thank you.
Thank you so much, and good morning, everyone. It's good to be with you here today. If you can just move to the slides, to my first slide would be fantastic. Yeah, good morning from Nationwide Children's Hospital. It's a busy day, clinic day here as well. So I'm going to be talking to you about pregnancy and oral health. And just this February is a Children's Dental Health Month. So I'm very excited that we're talking about oral health because it's important. So why does oral health matter? I think for many of us, when we think of oral health, you kind of think about, oh, it's your teeth need to look nice and it's just a beautiful smile. But I want to make sure that everyone understands that it's more than just a nice smile. We need our teeth to be able to chew, eat, swallow, and also speech is very important. So your mouth functions in many ways. And if you don't have good, healthy mouth, it can impact your functioning, and also it can impact your appearance and your ability to find job and work, and also your quality of life. If you do have tooth pain, you know, it's not fun to have toothache. So the picture that I have of the gentleman who's from a picture from many years ago, I believe from Cincinnati, that this young man who was trying to find a job and was not able to find any job because of his appearance and missing his teeth. And once he was able to get his dental needs taken care of, he's very nice, young, handsome guy. We kind of refer him as the Brad Pitt of Ohio, but you can see how teeth are important for your appearance and self-confidence, and also play a role in your ability to find economic support. If you move to next slide, but I want to make sure that we talk about this because there's a lot more that goes into oral health. We know that your mouth is a mirror to your health. So there are many diseases like heart disease, pneumonia, diabetes, HIV, AIDS, osteoporosis, Alzheimer's disease, and pregnancy and birth outcomes have a connection to oral health. And some of it is just association. Not really, we don't understand the cause, but we know that, for example, the two main oral diseases, cavities and gum disease, they both involve bacteria and inflammation. And all these diseases that are listed have some connection to inflammation and bacterial infection. So when you think of your oral health, just think about your systemic health and your overall health, because without good oral health, you can't have good general health. The picture kind of depicts all the organs and all the systems that have some connection to your mouth and the bacteria and the inflammation. So think broadly, it's just not your smile, it's not your ability to eat, but also affect your overall health. And many diseases are also first diagnosed by just looking in your mouth. If you can move to the next slide, please. So why does oral health matter? I think we all kind of agree that for the reasons of your overall health and your well-being and quality of life and ability to eat is important, but it's also important for your overall health. But many people, unfortunately, forget this important aspect of the well-being. And for many families, dental care and dental hygiene is often low on the list of priorities. And that could be for many reasons. If when you have so many things on your plate, you know, oral health might fall on the bottom of your list when you have to take care of all the other basic needs and social needs. In general, barriers to dental care include cost and financial barriers. I think that's one of the most number one thing that we hear about. What is the reason that you were not able to get dental care is because of the cost. And the second one is the perceived need. You have to perceive that there is a need. You have to perceive that oral health is important. You have to perceive that you cannot be healthy without your good mouth. So those are the main reasons. But also some people don't seek dental care because they're anxious and have anxiety, could have had bad past experiences, and they don't want to go to a dentist anymore. Sometimes you do want to go to a dentist, but there's long wait appointment times. You cannot get in, especially for younger kids. There might be difficulty for adults getting time off work. It's hard to find time off because when your employer doesn't let you. Also, in our rural areas, they face different barriers and challenges because there's not many providers who practice in rural areas. And also there's Medicaid providers are limited. We're going to get into this later on, that we have had an increase in Medicaid reimbursement rates. Hopefully that will help with that. But also travel and distance can be a barrier. If you don't have transportation, if you have to get on multiple buses to get to a dental facility, that can pose a challenge and kind of hard to get you the access that you need. So in 2021, Ohio Medicaid had an assessment survey, and they basically asked the families, what is your number one unmet healthcare need? And for children, dental care is the number one most common unmet healthcare need. It used to be number one for adults too, but in 2021, it fell to second place, second to the prescription drug coverage as the greatest unmet healthcare need for the Ohioans. And this is regardless of income. Next slide, please. So while it's important to maintain oral health at any time, it's very important during pregnancy because there's many things that happen during the pregnancy that can put a woman at a greater risk for tooth decay. For example, their diet changes, they might be doing more frequent snacking, there's morning sickness that goes on, and also there's less attention to the oral hygiene. So there could be more gum problems, there's hormonal changes that can exacerbate reactions in the mouth. So pregnancy is an important time to have really good oral health. And then the research has suggested that in pregnant women, untreated gum disease can have a systemic effect on the unborn child. Again, we don't understand the relationship and the cause perfectly, but there's some studies that have showed that if you have gum disease, you might be at risk of having a preterm birth for your child, for your baby. And also the other thing is that we know that the tooth decay and cavities is a bacterial infection. And if the mother has a lot of bad bacteria in their mouth, they can pass it on to their baby. And the children that are more than 3 times as likely to have tooth decay if their mothers have had high levels of untreated tooth decay. So overall, if your mouth is not healthy, it's not good for a pregnant mom to have an unhealthy mouth, but also it can has an impact on their newborns. So the message is that the oral health during pregnancy is safe and it is important. It's important to take care of your teeth while you're pregnant because it can have implications for you, for your overall health, and also for your baby in the future. There are some myths about oral health care during the pregnancy. I know you hear that like it's normal to lose a tooth for every pregnancy, or your baby can take calcium from your teeth. And many people think it's not safe to have x-rays or get numb. It can harm your baby. Those are all myths. We have good evidence and science that shows that dental care during pregnancy is safe and is recommended. So what are the consequences for pregnant women if you have untreated tooth decay or cavities? It can actually harm you if you have pain and stress because of your dental abscess or toothache and infection. Pain it kind of stress your whole body, so it's not good for yourself, not good for your unborn baby. Many pregnant women, when they have toothaches, they try to take care of it by getting over-the-counter medications. There's a lot of pain medications over the counter, so they self-medicate, and sometimes they take a lot of medications that is not good for them and can have impact themselves and impact their babies. Tylenol toxicity, liver toxicity associated with overuse of Tylenol is a problem. Then also, if you don't treat your local tooth abscess and infection, it can cause to systemic infection. You can have swollen faces. It can get into your body, and you may need more medications, more antibiotics that might not be good for you. And also, if your mouth is not healthy, you're probably not able to eat well and not getting the all the nutrition that you need for your baby and restrict the growth of the baby. So looking at what it looks like in Ohio for pregnant women and accessing care. So we can see, unfortunately, many pregnant women tend to not to get the dental care while they're pregnant. This data is old, from 2006 to 2008. If you look at the first row that says overall, about 40% of the pregnant women receive dental care during pregnancy. If you look based on age, race, marital status, and education, you can see there's disparities, with the younger pregnant women getting less care, 27.2%. We see that our non-Hispanic Black and Hispanic populations have lower rate of dental care utilization during pregnancy as compared to the white and non-Hispanic other. The unmarried pregnant women, lower rate of utilization, and also education. The less than 12 years, 23.5% have had dental care during pregnancy, compared to those who have had more than 12 years of education, almost double that have had access to dental care and utilize the services. So I said this is all data. If we go to the next slide, which will show the data from this is also the 2004 to 2008, comparing based on type of insurance, source of coverage, whether you have Medicaid or are non-Medicaid. The gray line on the bottom is the Medicaid population. The red line on the top is non-Medicaid, private insurance, private pay. You can see the disparity, the gap with the percentage of mothers who receive dental care during pregnancy from like anywhere under 30% to like high 70%. The data is from 2004 to 2008. If you go to the next slide, is 2018 Ohio Pregnancy Assessment Survey. Not much has changed. Only 44% of pregnant women had their teeth cleaned during pregnancy. There are disparities that in utilization of dental care based on income, age, geographic area, race, and ethnicity. Only 29% of women covered by Medicaid had dental care during pregnancy, as compared to 54% who were non-Medicaid. And among non-Hispanic Black women, 35% had their teeth cleaned, as compared to 47% of their non-Hispanic white counterparts. So you can see the disparities persist, and we can see that still going on. Next slide, please. So what are the limiting factors why pregnant women do not seek dental care? I think some of the barriers we talked about, such as financial barriers, transportation, availability of appointment, is the same. But when you talk about pregnancy, you have other layers as well. And some of it is related to the attitudes and beliefs that about dental treatment during pregnancy. And you can see it could be the woman, the obstetricians, or the dentist. Over the past 10 years, there has been a lot of effort to increase education that it is really safe. Sometimes pregnant women think it's not safe. They don't go. The obstetricians do not recommend going to a dentist and say, like, wait. And sometimes also the dentists, they're like, oh, wait until you're done with your pregnancy. And they don't want to take care of pregnant women. We are putting a lot of efforts to change the mindset and the behaviors and attitudes, because we know if one of the factors that has shown really great likelihood of promoting women to go for dental care is if their obstetricians make a recommendation to them. That's like very important and make more women to go. So we are working on that, and you guys have opportunity to also promote safety of oral health during pregnancy. So that's some of the barriers, but also the usual barriers of access and availability and transportation also persist. So in 2020, our US Surgeon General had a call to action to, in general, improve the maternal health. All the moms, they need to have better health. And in his recommendation was using preventive healthcare and wellness visits to conduct screening, assess risk factors, and provide education and counseling, including oral health. So they were saying basically, pregnant women or women in general are going to go for other type of visits with their primary care or their OBGYN, and there's an opportunity to do screening for other diseases, including oral health, and provide education. Next slide, please. Oh, we skip one. So in 2020, our Ohio Department of Health actually had a call for a grant opportunity to support new initiatives to demonstrate the ability of nonprofit primary healthcare facilities to integrate oral health into their prenatal services. Basically, if you have a prenatal service at your institution or your clinic, we would like to give you some money to see if you can show you can successfully have an integration program. So the next slide, please. So here at Children's Hospital, we have a teen and pregnant clinic. Basically, as the name implies, is basically for adolescents and young children from age 12 to 22 in Franklin County. And the goal of the clinic is infant mortality. So we applied for funding from the Ohio Department of Health. We were successful and received the funding to show this demonstration project that we can actually have, when the pregnant mom or adolescent or young adult would go to their prenatal visit, they would get some oral health evaluation and risk assessment and education. So next slide, please. So what we had to do, we had to train our prenatal providers, all the OBGYN physicians and their nurses, to do some dental screening. So they got training in what to look for in the mouth. They got training on what questions to ask, like, do you have any pain in your mouth? They got training on what the cavity might look like. And the part of it was also not just identifying the pregnant women who had dental needs, kind of, was it urgent? Was it need to be routine, or just needed cleaning? Was also to make a referral, and we do have a dental clinic at the hospital. So the goal was integration, that they would make an assessment, they would refer to us in a dental clinic, and then we will schedule them and take care of their needs. So that's what we're doing. Next slide, please. Also, another second goal of this funding was to provide a lot of education during pregnancy for the pregnant women about the safety of dental care, talking about the diet and good oral hygiene, what foods to eat and what not to eat, talk about the oral issues that you find during the pregnancy, and basically how to take care of your teeth and how your oral health can affect your health and your health of your baby. Next slide. So as a pediatric dentist, I see the end result. You know, pregnancy is a teachable moment. If they don't get all the information and instructions on how to prevent the tooth decay in their baby, by the time I see them, it's too late. We know that the babies who have had their first dental visit by age 1, tend to have less cavities. And that is a recommendation for all of you who have young kids. All babies need to have their first checkup at age 1, because we can talk about how to prevent tooth decay that early on. If once the cavity starts, it's too late. So the goal is early intervention and early education. And sometimes family thinks, my kid doesn't have many teeth. Why do I go to a dentist when they're only one? It's a lot of education and prevention and discussion and talking about how to not to have tooth decay with your kid. Next slide, please. So baby teeth are important. Some people think, oh, baby teeth can fall off, and they're not important but we know they can cause pain, infection. Baby teeth maintain space for your adult teeth. So if you lose your baby teeth early, it can compromise your teeth later on when they come on later on, and it can impact the quality of life for the kid. We know that go back one more slide. 51% of the children between ages 6 to 11 have cavities. 1 in 10 children who have cavities suffer from tooth pain, and there are 51 million hours of school hours are lost each year because of poor oral health. So next slide. So what are the consequences? I talked about the abscess and infection and pain, but in kids can go south really bad and quick and fast. So these are the kind of infections that I see every day that we treat in our clinic. Walk-in patients just walk in because of the infection. A simple tooth cavity that could have been fixed now has gotten so bad that has caused facial cellulitis, facial swelling. And in the picture on the bottom that you see with the abscess is trying to drain through the cheek, which is really bad. And these are all emergent cases. This can compromise the health of the kid. All these kids need to be admitted in the hospital and treated under surgical cases. If you go to the next slide. So these are the kids that come with swollen faces. They have to go to the operating room. Like any surgeries, they have to be intubated. It's very costly. You're talking about tens of thousands of dollars spent to take care of the mouth, not including the cost of admission and staying in the hospital overnight. So it's something that we take seriously and need to really, early intervention is the key. Next slide, please. The ultimate thing is that you can die. People maybe not realize, I know we have antibiotics and has been really helpful, but this young boy, Diamante Driver, many of you may have heard of him in Maryland years ago, who had a toothache that was not able to get care in a timely manner, and his tooth abscess turned to a brain abscess, got spread into his brain, and he got hospitalized, had multiple brain surgeries, but eventually, unfortunately, he passed away. And so as I said, it's a serious thing. And if you go to the next slide, locally here in Ohio, we also have a young gentleman who died in 2011. This is in our own backyard in Cincinnati because of the dental abscess infection who spread to his brain. And lack of insurance is the barrier, and picking between taking antibiotic or getting a tooth taken out. So it was just a very unfortunate, but just the message is that it's a serious issue. Next slide, please. Just to show you how many people actually go to the emergency department because of the dental related condition. You can see all emergency department visits, over 2 million of them in 2018. About 1,800,000 of them were treated and released the same day. And then 110,000 actually got admitted to the hospital. And unfortunately, many of them, when they go to the hospital and in the emergency room, they get treated and released the same day. It's mostly they put on antibiotic and then their dental care is not taken care of. So it doesn't really address the matter. Next slide, please. So what does it look like for our school-age children in Ohio? This slide shows the percentage of children who have cavities or history of the tooth decay based on income and based on geography. So on the left side, you see the blue bar and the yellow bar. That is talking about the higher income versus low SES. You can see the gap, 60% versus 38%. And on the right bar, you see the orange and the kind of a red magenta color is comparing the children who lives in Appalachia versus children who are non-Appalachian. And again, you see the disparity that the history of a tooth decay is more in Appalachian children and children from lower income when it comes to kids. Next slide, please. And then looking at dental care utilization for children based on Medicaid or private insurance. The top row, it says 47% of Medicaid insured children in the US have utilized dental care compared to in Ohio, only 35%. When you go to private insurance part, you see 66% of United States versus 65% of Ohio. So in private insured children, the rate of utilization, Ohio is very similar to the national level. But when you look at the Medicaid insured, Ohio is way below. And if you look at the graph, the top row, the top columns with the, again, red color has all the states listed, and the red color for Medicaid, we are at the bottom as compared to all the 50 states. Again, our privately insured are in the middle when it comes to rate of utilization for our kids. Again, showing the disparities. And I talked about this a little bit, that our rural areas have a lot more disparities, especially when you compare the rural, urban, and Appalachian. Children in Appalachia have 50% more untreated cavities than children in rural counties, and also 69% more than children in the urban counties. And if you look at the map of the Ohio, 7 of the 11 counties where children have the poorest oral health are in Appalachia. So that's where our disparities are for our kids, income and Appalachian region. So what can you do? You can be champion for oral health. I think this quote from our Surgeon General that who said, if we are to increase the nation's capacity to improve oral health and reduce health disparities, we need to enhance the public's understanding of the meaning of oral health and the relationship of the mouth to the rest of the body. So with that said, I ask you to all to be a champion of oral health, and I'm going to pass it on to Miss Susan.
Thank you so much, Dr. Amini. That was very insightful, and I learned so much. I can tell you're very passionate about this work and the topic. Up next, we will hand it over to Susan.
Good morning. Thank you for having me this morning. And as we go through the presentation, you'll see that I worked with Dr. Amini for 6 years at Nationwide Children's Hospital. And so a lot of the things I said, I will be saying she's already said, which is just good. We'll just keep it going here. So let me go on to the next slide. I wanted to share a little bit about the Ohio Association of Community Health Centers. That's where I work. We are a nonprofit membership organization representing 59 federally qualified health centers and lookalikes. FQHCs are also referred as community health centers. Next slide. Our community health centers are the largest primary care network in Ohio. We provide comprehensive care to 1 in 14 Ohioans and 1 in 7 Medicaid beneficiaries. We are located in 76 of Ohio's 88 counties. Next slide. Our community health center mission is to provide accessible, comprehensive, and quality primary health care services to medically underserved communities and vulnerable populations. A couple of my favorite cornerstones that are listed here are that each of the community health centers are governed by the community themselves. So more than 50% of their board members of the community are part of their of the board. They are the actual patients of the center itself. And of course, we are open to all, regardless of insurance status or ability to pay. We are a safety net. Next slide. Here are some of our numbers. As I said, we have 59 community health center organizations, and they have multiple sites. So that makes 511 locations. We have 117 school-based health centers sites, and we have over 100 dental sites throughout Ohio. Next slide. So a community health center they are required to have these services from HRSA. And as you can see, we've been talking about integration, as you can see that the community health centers can easily integrate with other providers because many of these services that you see happen under the same roof. We treat the whole person. Our CHCs must provide all of these services. Some centers will do so by contracting the services out. So let's say it's a small community health center and they don't have dental. So they'll contract that out to the private practice dentist in the community. Next slide. This is a picture of our map of all of where our community health centers are located throughout Ohio. I know it's hard to read, but we do have an interactive map on our website that you can just put your zip code in and it will show you the closest community health center to you. Next slide. This is the highlighted counties that you see are where our dental centers are located. Like I said, not all of our health centers have dental, but will contract out to the community dentist. Next slide. So community health centers are always focused on quality. They must report quality measures to the federal government once a year. They're reporting on 18 different quality measures. And as you can see, I wanted to point out the first one right there, where we are second in the nation for dental sealants, excuse me, for children ages 6 to 9, only second to only Kansas. And it's only by a few percentage points. So we will get them next year, I promise. Next slide. And if you're looking for more information about community health centers, here are some links that I've provided that you can click on and you can get lots more information about a community health center. So we've been talking about integration, and true integration is bidirectional and collaborative. And as I said before, community health centers are integrated and practice high quality whole person care. Next slide. Dr. Amini pointed this out already, that oral health is not simply the absence of oral disease, it's oral wellness. That's the ability to speak, smile, taste, chew, and swallow. Oral wellness affects obtaining jobs, confidence, and life enjoyment. According to the Ohio Department of Health, they report about half of the school-age children have a history of tooth decay, and 1 in 5 children still have untreated cavities. I took this slide, I'm sorry, go back just one. I took this slide from Smiles for Life. If you go and go to their website, smilesforlife.org, they have a lot of the training modules that you can actually get free CEUs for. They're focused on medical providers, training the medical providers on the subject of oral health. Next slide. So Dr. Amini really already shared a lot of the barriers to care. I wanted to touch on a few of them. We do have a shortage of the dental workforce here in Ohio. Actually, it's throughout the nation. There is a major shortage of dentists, hygienists, and dental assistants. I put a link on the last slide of the dentist-patient ratio in Ohio. But in Ohio, overall, there is 1 dentist for 1,550 patients. So, for example, if you look at Harrison County, there are only 2 dentists in the whole county. So that is 1 dentist taking care of 7,240 people. That's a lot. And like I said, the link will have all the other counties there so that you can look at them. And that obviously leads me to the long waiting list. Dr. Meany talked about that. Many of our community health centers have about 3 to 4 week waiting list, and that's actually pretty good. I have heard many like 6 months. So we do have emergency care, same-day emergency care that you could go into our health centers and be seen for emergencies. And like Dr. Amini said, many of those patients will go to the ER, and there really isn't anything that the ER can do other than maybe give them some a pain pill and antibiotics. So there's not definitive care. So it's by going to the ER, it costs lots of taxpayers' money. So it's not a great way of doing it. Next slide. Because of the barriers to care, we needed to develop a new type of interprofessional partnership between primary care and dentistry. Medical providers can do oral health screenings, as well as dental providers can do tobacco cessation screenings, behavioral health screenings, and blood pressure screenings. I have a great example of treating the whole patient. I had a grant with tobacco cessation screenings where we did screenings on the dental side, but the whole team at Family Health Center of Darke County was one of my favorites because they literally had a whole team working together, the medical provider, the dental provider, the behavioral health, and a pharmacist, all working together, excuse me, for that patient, and helped succeed in quitting tobacco, treating the whole patient. Next slide. Dr. Amini already touched on this a little bit. The Ohio Medicaid Assessment Survey data shows that more than 50% of prenatal women have no dental care, and less than 30% of young children receive dental care. So we could see these patients, these children, during a well-child checkup, and that will help. The medical provider is actually someone that's looking at these little kids' mouth and referring them to a dentist. The primary care Medicaid reimbursement is $15 for a medical provider to do an oral health screening and apply the fluoride varnish and provide anticipatory guidance for the caregiver. Next slide. Dr. Amini talked a little bit about this. First tooth or your first birthday. The American Academy of Pediatrics recommends a child to be seen by a dentist by their first tooth or by their first birthday. But I know of some people, even my daughter-in-law called a dentist, and they told her that they didn't want to see my grandson until he was 3. And that did not sit well with me. Many times 3 is just too late. Dr. Amini showed you pictures. When I worked at Nationwide Children's Hospital in the dental clinic, I actually saw the mouth of an 18-month-old child where 19 of his teeth had to have some sort of work done. So by the age of 3, it's too late. They're taken, those patients, as you saw, were taken to the OR and put under general anesthesia to be able to take care of those restorations. Next slide. So we do have the American Academy of Pediatrics. They did issue an oral health policy statement many years ago and gave 6 recommendations for the pediatricians. And you can see those there. Next slide. So what brought me to OACHC 15 years ago was a grant from Health Path Foundations of Ohio. It was called the Early Childhood Oral Health Initiative, and we lovingly called it ECHO. Next slide. So ECHO integrates preventive oral health practices within the primary care settings. In 2008, I went on the medical side of our community health center and trained the medical providers how to do an oral health assessment as a standard of care during the child's well-child check for children 9 months to 36 months of age. And later in the grant, we changed that to include children through the age of 5. You can see our goals there. I'm sorry. Yeah, we can see the goals there that we wanted to be able to see the child by age 1 and establish those oral health screenings, and to significantly reduce the oral health issues for children under the age of 3. Next slide. Here's a picture of a training that we did. This is a medical assistant applying fluoride varnish to the little kiddo. There are 3 parts of the oral health screening. It's actually the exam looking in the mouth, the application of the fluoride varnish, and the anticipatory guidance to the caregiver. Medicaid will reimburse the medical provider $15 for that assessment. Next slide. Dr. Amini did touch on this. a little bit, but Medicaid, it did extend the eligibility for pregnant and postpartum women from the 60-day of postpartum to the end of the 12th month postpartum for all women. Extending that eligibility for a full year of postpartum ensures that the woman has access to critical services. We are blessed in Ohio that our Medicaid dental coverage is comprehensive. We are only one of 36 states that have comprehensive coverage for dental. Many of the other states only either have none whatsoever or emergency only. Next slide. And we have a reason to celebrate this year. For the very, very first time in 20 years, yes, I said 20 years, Medicaid increased the dental reimbursement rates. So hopefully this will help with our access problems. This will allow the private dentists to be able to afford to see the Medicaid patients. So we're excited about that and look forward to see how that's going to help with our access problems. Next slide. So now let me take off my OACHC hat and put on the Oral Health Ohio chairperson of the board hat on. We have a coalition here in Ohio. And Marla Morris, who I think is on the webinar here with us today, she is the executive director and she is doing a magnificent job. We have a diverse group of stakeholders on our board that represents the Ohio Dental Association, the Ohio Hygienists Association, the Nurses Association, the Ohio Department of Health. Dr. Meany represents the Ohio chapter of Academy of Pediatric Dentistry. We have a gentleman that represents the Federation of Health Equity and Social Justice. We have a lady that represents the Northeast Ohio Black Health Coalition. And this just is to name a few of our board members. Our goal here is, you can see all of our goals there, but the first one is to educate our policymakers so that they can make informed oral health policy decisions. And so what we want them to do is we want all the legislators, we educate them, and we want to make sure that if they have a question that they will come to Oral Health Ohio, that we can help them make informed policy, oral health policy decisions. Next slide. So the Oral Health Ohio contracted with the Health Policy Institute of Ohio to facilitate and create the 2023-2027 state plan, which is designed to guide actions taken by the policymakers, advocates, educators, providers, and funders. The plan was developed with the input of approximately 200 Ohioans across our state through healthcare provider focus groups, consumer focus groups, and a multi-sector advisory committee. I have provided a link on the last slide to both the Oral Health Ohio's website and to the state oral health plan. And those are the resources there. The first one is a product of its environmental scan chart book, has lots of information on it. I have a HRSA grant that I am doing right now, and this is a product of that grant. And Marla from Oral Health Ohio helped do create that chart book for us. The next resource is the National Maternal and Child Oral Health Resource Center. It is full of education pieces, and there you can download them and print them and give them to caregivers. They are multiple languages, so you want to check that out. All of these are clickable. There is that site that I talked about, the Ohio County ratings for the ratio between the dentist and the patients. There's Oral Health Ohio, there's the state dental plan. And I did include a white paper that I felt was really full of great information on integrating oral health care and primary care. It's a learning collaborative. So you can click on those and learn more about everything that we talked about today. And I thank you for your attention.
so much, Susan. Your impact and the time spent across the state advocating for children and children's dental health has been greatly felt, and we definitely appreciate you for your work. And thank you also, Dr. Amini, for giving us the great information on the need for dental health and access. I know this has expanded my knowledge about the essence of access to dental health resources for pregnant women and young children. So now we'll shift our gears to questions. But before I go to questions, I will make sure to send Susan's resources that she linked at the end of her slides. I will make sure to send that through an email after the webinar is over to all the attendants to have access to those resources. So now we're going to shift our gears to a few questions I've prepared for each of our panelists. I'm going to begin with questions for Dr. Amini. Dr. Amini, what is one story that stands out to you that illustrates the importance of dental access and health outcomes for mothers and children? And if you can discuss how this relates to the social determinants of health.
Thank you for the question. So I can think of an example of our pregnant adolescent who came in, a 14-year-old pregnant. I mean, that's by itself is another story, you know, a 14-year-old pregnant who had had a toothache for like months. Like she has been in pain for a couple of months and came to our hospital, and we were trying to figure out who was her legal guardian to get a consent for her work, and learned that her mother had passed away and her grandma was her legal guardian, who was in a hospital because of a heart failure. And here she is with a swollen face and is in pain, and she's pregnant. So I think that picture illustrates the, first of all, like the importance of there's a lot of barriers and social determinants of factors that goes into it. So just, she didn't have transportation. We had to arrange for transportation for her. But eventually, like she had been in pain for 2 months. And I think for anyone who had been in pain for 2 months, and that's just unbearable. So if when you're in pain, you can't concentrate, you can't eat, you can't sleep. So it not only impacts your own health, but you have a baby that is like a fetus that is growing. So that's going to impact the health of them. But oral health is also like other diseases, is a lot of social determinants of health that kind of impact it. So if you don't have access to transportation, if you don't have the resources like food, good food insecurity, all that stuff can impact your oral health as well. So it's a complicated problem. And I think we sometimes focus on the tooth, but social determinants of health play a very important role to access to dental care.
Definitely. And this brings to mind something you mentioned in the beginning about the myths of pregnancy and dental care or dental health in pregnancy. I just wanted to clarify, you said something about calcium, pregnancy taking away calcium is a myth. If you can clarify what that means and how that calcium is affected or not affected during pregnancy.
Yeah, I think women think that because the teeth have calcium in it, and they think like when you're pregnant, your body needs calcium, and that's the calcium is taken out of the teeth, and that makes your teeth weakened, and that's why you get cavities. That is a myth. Your baby does not take the calcium out of your teeth. So if your teeth are bad or breaking down, it's not because of your pregnancy. It's probably more of your diet related, the sugar exposure, and the bacteria that you have in your mouth causes that cavity.
Wow, thank you, Dr. Meany, for
Pregnancy
answering
does
that.
not weaken your teeth by itself.
Wow, thank you for that knowledge. And I'm just gonna go back to the next question. Because I was like, I wanted to clarify that as you mentioned. If a parent or caregiver or child care provider is listening to this webinar and might be interested in how they can gain access to affordable dental services for themselves, children, or families, and this also applies to Susan's work with the Ohio Association of Community Health Centers, that they want to help the families they service gain access to health dental health services. Is there a link or a number that they can access or call to find out where they can seek these programs?
So the Ohio Association of Community Health Centers that Susan mentioned, I think they do have a list and a link, and also Ohio Department of Health also have those listed. So I would say if you go to ODH website, they have a list of all the safety net clinics. For children in particular, I would say like our safety net clinics are Nationwide Children's Hospital. We do have a walk-in clinic, which is for emergency toothache pain and infection and swollen faces. So we do have a wait list for other regular appointments, but if your kid ever has a tooth pain, abscess, please feel free to come to our hospital. We take care of the local and also families who travel 2 hours to get here. Cincinnati Children's Hospital has a dental clinic, and Cleveland has the Rainbow Children's has a dental clinic. Ohio, with Medicaid reimbursement going up, I'm hopeful that more dentists will join up. But in general, pediatric dentists in the community, I would say 70% of the pediatric dentists accept Medicaid even before this bump. So I think for children, finding a dentist for kids might be, I don't know if it's easier or not, but we all have long waiting lists. But for adults, I would say the safety net clinics are probably the primary source of that.
Yeah,
Thank you.
I would just go ahead and say that all of our FQHC they see patient no matter of their ability to pay. And if you go to our site, ohiochc.org, they have a map there, and you can actually just put your zip code in it, and it will show you the closest community health center to you. And we do have walk-in emergencies also, like Dr. Amini has. It's kind of a first come, first serve, but they will see you that day if it's an emergency. So.
Thank you both for that. And my last question for Dr. Amini, with your extensive experience in dental care, what would you like legislators listening to this call to know about the importance of access to dental care for Ohio's mothers and children?
Thank you. I think I kind of covered that a bit in my talk, that the consequences of oral health can be very bad and detrimental for the health of the mother and their unborn child. So looking at those pictures and images of the swollen faces, hospital admissions, I think the message is be a champion for oral health. We have challenges with getting dentists to go in the rural area. Think of creative solutions that would recruit dentists to the rural area. We have challenges with Medicaid reimbursement. So thank you to legislators for approving the budget that helped us to go up. So that hopefully we'll see how effective that is going to be, which I'm sure it's going to have good impact. The safety net clinics support our safety net clinics, our community health centers. All the things that you can, again, promote oral health at any opportunity that you get. Try to integrate anywhere that you can, that oral health can also be part of the menu and is not left out. I don't know, for some reason, people think that your mouth is not connected to the rest of your body, but the message is it is.
Definitely. Thank you so much, Dr. Amini. And Susan, as you mentioned, you and Dr. Amini both mentioned that Ohio now has one of the most comprehensive Medicaid coverages for dental health for mothers and children. How do you think the state can move forward from the progress that they've made in Medicaid access to dental care for mothers and children? Basically, like, where do we go from here?
Yes, thank you. I think just like I talked about, where the medical providers are actually looking into the little kid's mouth, and I think we can do that, integrate oral health education into prenatal care, and that would be the OBGYN docs. They could educate patients about how oral health benefits in Medicaid for pregnant women, that preventative cleanings are safe, as Dr. Amini said, during the pregnancy, and the importance of oral health to overall health to the pregnant mom and her child during and after pregnancy. I think including oral health in OBGYN trainings programs would be a good thing. And we actually are embedding a hygienist in our OBGYN practices here in our FQHCs. And that it was obviously a way we could help in that area as well.
Definitely. And you and Dr. Amini both mentioned about the disparities in healthcare, dental care access for people in rural and urban areas across the state. Do you know any statistics about maybe other states, what other states have done to kind of bridge this gap?
Well, I was thinking about this, and I really don't think that other states have really bridged that gap. There are some that are trying some new things to do that. Teledentistry is being used in some states to bridge this gap. For example, California has teledentistry, and that helps with the access problem. Oral Health Ohio has convened a work group to look into the access of care via teledentistry. And we're working together with all of our stakeholders to try and work and get teledentistry, be able to use that here in Ohio. So there's lots more to come on that subject. So.
My last question, I'm going to put two questions into one, if you don't mind. With your experience, extensive experience in advocating for dental care for children across the state, what is one story that of impact that sticks out to you? And also, what would you like legislators to know as well about this issue?
Well, poor oral health is one of the greatest barriers to employment. And I know Marla shared a story with me about a woman that wrote into Oral Health Ohio. And back when we were wearing masks, I don't know about you, but I hated wearing masks because I felt so claustrophobic. But this woman actually said she loved wearing masks. And that was because she had poor oral health. She had missing teeth, and she could never get a job because she would smile and she wouldn't get the job. So she actually went and interviewed for the job, and we were all wearing masks, so no one saw her teeth. And the funny part about that is that she was able to get the job. She got dental insurance, and she was able to get her teeth fixed so that she could, be able to enjoy life. That's one of my favorite stories. So I think that's a good one. I think that, the legislators that are listening, I don't know if everyone knows this. I just learned this recently, that during the SNAP services, where people can go and get food, the SNAP services does not include the hygiene products, which I did not know that you can't buy toothbrushes and toothpaste with your SNAP services. And I think that would be something that we could work on so that, I've actually heard of families sharing one toothbrush, and that is in Ohio that happens. So it's hard to believe that we share toothbrushes, but if that's a barrier to care, I think that's something that we can work on. The use of teledentistry, I already mentioned. And then to fund research on effective interventions to improve oral health in pregnant women and children. I think this would guide future policy and program development as well.
Thank you both, and thank you both for answering my questions. We have a few questions in the Q&A, and I'm going to read it off. And one is from Dr. Sue Keller. She says, I'm a dentist, so familiar with the importance of dental care during pregnancy. What can we do to transform public and professional knowledge to promote oral health as a standard and bring education and care to women in the community where they are? Basically, I think she was just saying that why is this still such a barrier in 2024? If any of you would like to tackle this question.
I would say things do not move fast, and I know we have been trying to address the disparities for many years. I think there has to be more of private-public partnership with focus on oral health. And I think it's going to take time, and we need people who are champions of oral health and people who are in power, who can do things and allocate resources to do their job. I think our job is just to advocate, or that's all we can do, just advocate. But I think we need the people who are able to do more and have the power to do so step up to the plate and do their part. Yeah, Dr. Keller, you know the problems better than I do. So I appreciate the challenge. I think the school, one of the things we're doing locally, we got funding. Again, it comes from funds. That's what you can do at Children's Hospital. We got couple of $1 million of grant to establish school-based oral health program in Columbus, Ohio. I know Cincinnati has a couple of them going on for many years, but again, we are trying to get the care to where the kids are, because not everybody can walk into my clinic and hospital. So how can you creatively, and I think you mentioned the mobile unit. Yes, mobile units are great way. I know they're costly, but somebody need to provide the funds and the resources, and somebody need to do it. And there are many ways of getting access to care to where they're needed. It's just the will and the funds and the resources to do it.
Yeah. Yes, definitely. Also, she added that is the training that Susan mentioned that you gave to medical providers. Are they available on slides as well?
Yes.
I think Susan mentioned it, and we make sure it gets in one of the resources. But we use for the prenatal training was the Smiles for Life that Susan referred to. We make sure that the resource is there, and that Maternal and Childhood Resource Center has a lot of information. So yes, Susan, I think covered it.
Sounds good. Let me read through this last one. I think you guys mentioned mobile teams, and I think her last question deals with the use of mobile oral healthcare and to attract new dentists ready to retire from private practice. Do you think this could be a great idea to just apply mobile health or mobile dental health services to kind of attract new dentists and also retiring dentists as well?
Yeah, definitely. I think Susan knows better than I do, but I think there's also safety net clinics that are struggling to recruit dentists. Like, might be, I think, priority to, like, mobile units are costly to operate, but there are places that are already struggling, and I think we need to fill those spots probably first before we delve into other. Yeah, that's my opinion. Susan, you can chime in.
Well, yeah, no, I was just the lack of our dental workforce. We definitely have a problem there. We have not enough dentists to see the patients. We actually have health centers that have, multiple chairs and, can see patients, but we just don't have the dental workforce to be able to see them. So there's definitely a problem there. So we need to work on that.
And even in addition to that, her last question is, why aren't ERs required to have a dentist on staff? If any of you know why this is so, yeah, yeah. So definitely thank you all. Thank you, Dr. Amini. Thank you, Susan, for answering the questions. As a shameless plug, Dr. Amini penned an amazing op-ed or amazing blog on the challenges and opportunities for oral health in Ohio. And you can read this blog by visiting www.groundworkohio.org/news. The news tab is at the top of our website, and you see her picture right at the top, and her blog is very educative and informative if you'd like to learn more about this topic. Lastly, I would like to thank you all for taking the time to join us in this important discussion on dental health in pregnant women and young children. I know we've gone 4 minutes past your time. I would also like to extend my sincere appreciation to our esteemed panelists, Dr. Amini and Susan. This webinar would not have been possible without them saying yes when we reached out. Groundwork Ohio appreciates you all so much and your efforts, alongside everyone who tuned in today, who does work or related work in the field and joined the conversation to learn more on the topic. Your presence is greatly appreciated. Our next webinar will be on infant early childhood nutrition on March 27th at 11 a.m. Please look forward to receiving updates and emails. And you can also find updates on this in our newsletters that always comes out every Friday morning. Once again, thank you all for joining us, and I hope to see you all on our next webinar. Thank you so much, Susan, and thank you so much, Dr. Amini.
Thank you.
Thank you. Appreciate it.